You're listening to Online Pet Health Podcasts with Dr. Megan Kelly. Continuing education for veterinarian rehabilitation therapists. Learn more at onlinepethealth.com.
Hey vet rehabbers, Anae Lloyd from Online Pet Health is going to be chatting to Marinette Teeling from Equilibrium Veterinary Physiotherapy College based in Plettenberg, South Africa. And today they're going to be chatting about the Finnish Stifle Canine Index. Now, this is something that I'd heard about, but I didn't really know much about it. And I found this really, really interesting, and I think you guys are going to enjoy it. Over to Anae and Marinette.
Hi, Marinette. Thank you so much for joining us today.
Thanks for having me, Anae.
Okay, so Marinette has recorded a research refresh for us on the canine platform, looking at the Finnish Canine Stifle Index. So Marinette, tell us a little bit about that research paper and what we can expect to learn if we go and watch that.
So Anae, I actually looked at two papers that focused on the Finnish Canine Stifle Index. The one that I initially wanted to look at is this index responsiveness to change and its inter-tester reliability. And when I started looking at that, that made me really interested in looking at what the physical index itself was. So the second paper I look at is how they've set up this battery of tests that they then put into, called the Finnish Canine Stifle Index. And it's basically a objective outcome measuring tool to measure stifle function levels or stifle dysfunction levels in dogs with compromised stifles. So they look at how responsive this outcome measure tool is. So if you use it over a few weeks' time, whether it can pick up that the dog's stifle function is improving. They also look at like a cutoff amount that'll say that this stifle is pretty compromised, or the stifle is functionally all right, so adequate. So yeah, it was pretty interesting to look at that.
Okay, fantastic. So if we think about outcome measures, what are important for us to consider? Like, why are outcome measures important to begin with? And then what should we take into consideration when we're choosing outcome measures to use clinically in our practices?
Sure, and there's actually probably quite a few things that we should say on this now, but I think for us clinically, the most important reason is to know that we're actually improving, that we're actually moving forward in a objective manner. So if we don't have measurements, we're subjectively saying we're going forward, or maybe we're not actually improving the patient or something about the patient. So I think clinically that's the most important reason for us to be able to say, listen, we're moving forward, or actually we're moving backwards. We need to change something about what we're doing. So I think from a science point of view, physiotherapy or rehab is supposed to be a science or an evidence-based profession. So, and that implies that we can objectively say that we are improving something. And that's why outcome measures is also important from that point of view. And maybe it's also good for us to be able to refer patients between different professionals or different or like colleagues, and you'd be able to take the dog on and know that this is the baseline where it was at last week. So is it better or is it not better? And something that's objective and not subjective. Yeah,
I think those are probably the most important points. And then, like, perspective, I would also say that if you're using objective outcome measures with every patient every time, it's so much easier, and this is just because my mind is so geared towards research at the moment, but it's so much easier to then take all your retrospective cases that you treated for one condition and put them together and see see what that looks like, and then look at doing a retrospective study. And I think, like you said, referring to other practitioners, that would be very valuable. And the owner aspect as well. Like, if we can say to our owner, look, right,
sure,
on this piece of paper, this is, I'm not making this up, we're not imagining this, your pet is improving, I think it's really important for the owners for us to be able to really say to them, on paper, this is what's happening, and also for our relationship with the vet, right? So that we can also give them something with numbers that's objective, that they can understand and say, well, even if I have no idea what you're doing, I can see that it's working.
Sure. And I know that actually it reminds me that I came across something in this article that I haven't seen before, and it's called the MCID score, which is the minimal clinically importance difference, which is a factor that they use when they're looking at clinical case studies or clinical objective measurements, is to evaluate the smallest change that is meaningful to the patient in your treatment outcome. So the minimal or the smallest change that they would be considering as being super important and would indicate a change in the patient's status. So I think that is also quite important for us to take into consideration, because very often either one, we want to see the tiny little difference, which we know means the dog is moving forward, but maybe we're focusing on some things that are too small that doesn't actually functionally make a difference. So it's I'm definitely going to start looking at that a little bit more to see if they've looked at the concept a little bit in other papers.
That is very interesting, because I mean, if we think about it, there are a lot of conditions that heal with time. So without any intervention, like healing and improvement is going to take place. So what does that look like then? And then how do we compare that to whatever interventions we're using, and the difference that we should be seeing then with that? That's really interesting. I actually hadn't thought of that. The minimal clinically important difference, something. Yeah.
Yes, that's good. That's right. Yeah.
That's very cool. Okay, so back to the Finnish Canine Stifle Index. So it's a battery of functional tests. Do I understand that right? What do these functional tests look like, and how practical are they for us to use in practice?
And I think this is super practical, and I think the majority of people are already using it in their practice. But now what they've done is they've put a scoring, a way to score it in place. So the first, they look at 8 tests. They look at the sitting position of the dog, the lying position, the symmetry of thrust when the dog goes from sitting to standing, the symmetry of thrust when the dog goes from lying. Then they look at the symmetry of weight bearing. So they actually used bathroom scales of hindquarters. They looked at muscle mass, and then they look at stifle flexion and extension. That's what they look at. So, I mean, those are things that we use every single day when we evaluate dogs, specifically even more when we look at hindquarter issues. So then they would score each of them on a 0 to 3 score, according to being adequate, or 3 if there's lots of compensatory changes, or changes in weight bearing. Yeah, so I think it's very practical and pretty easy for us to use in practice.
Yeah, it sounds like at bathroom scales. Hey, that's a solution I haven't thought of.
Yeah. Yeah, I'll have to look at it, because I know that we have actually tried to look at using some scales in evaluating weight bearing, and I think there's a trick into getting them to be reliable. So yeah, but yes, it's something simple that we could use.
But yeah, I mean, my bathroom scale is ridiculous. Sometimes it doesn't even give me a number. So I think you would have a pretty nice bathroom scale to be able to use this. And also for smaller dogs, where they're really light, it would need to be able to pick up those small differences. So that would be really interesting. If you look into that, Marinette, let us know. Okay.
Perfect.
And then while you were presenting the research refresh, I was thinking about, or at least you brought up this thing about the position of the dog when you're asking for a sit and for a down. And I mean, we know that there are so many dogs that will naturally sit sideways or lie sideways or put themselves in super weird, funky positions. And they do that without there being any actual pathology, probably. So, so how important is it for us when we're using this index to position the dog, or to say we're going to go into a square sit, or we're going to try and achieve a square sit, versus looking at what they're offering naturally?
Nate, I think that's quite a challenging question, because I agree with you. I think there are some dogs that naturally don't sit square. But if I ask a dog, no, I think what I would look at is, if I ask a dog to sit and they don't sit square, I would put a question mark on it, point one. And then I would ask them to try and sit square. So I would try and set them up in a position so that they don't flop down, that they should actually sit square. And then if they can't do that, I would start thinking that there's a bigger issue. So very often dogs that are compromised stifle-wise or hock-wise, they often start sitting square and then they flop down onto their hindquarters. So there you can already see that they were thinking of producing a nice square sit, but they can't give it, and then they flop to the side. Some of these labby type of dogs, or your Goldies, they're just so happy if you've got a treat in your hand and you ask them to sit, they just want to get their bums on the ground as fast as they possibly can. And then they flop to the side. But yeah, I would look at what they naturally do. And if you ask them for a nice sit, they naturally don't sit square, I'd still put a question mark on it. And maybe use that as an outcome measure to see if over a period of time, for whatever you're treating them, if you then ask them to sit square and you kind of re-educate a nice square sitting position, whether they can actually produce it. Yeah.
Definitely. And then the other thing you brought up is our passive range of motion measurements, or our joint angle, our normal goniometry angles. Tell us a little bit about that and what they did in the paper.
So they measured obviously extension and flexion of the stifle joint, and they used their control group as a normal, and their normal values are pretty close to the published data, but their one wasn't. I think it was the flexion that wasn't entirely the same as the published flexion data. But what I think is lacking for us at this point in time is that different breeds and different size dogs are going to probably have different ranges. I mean, if you think about a Ridgeback's flexion of the hock, or a Greyhound flexion of the hock versus a Border Collie flexion of the hock. I mean, quite a few of your houndy type of dogs, they don't have what we would consider full flexion of the hock, where the digits actually get to the stifle. But that for them might be very much normal. I take it down as being normal. But if I take a Border Collie and I flex the hock up and it doesn't touch the stifle, then I think it's not normal. So they use their control group to set up what is normal values, and then they scored them according to that. But what I brought out from there, or what I think I was thinking from there forward, is that it might be in our best interest to start looking at breed-specific range of motion normal data. And it probably won't count for every single joint. I think that the hock joint's probably the most significant one that probably will change. But it would be interesting to look at whether breeds all have the same ranges, and if the physical amount is the same.
I think that's super interesting, and it's very relevant to us because we want to be science-based as much as we can, but really for us to have objective outcome measures in anything, it actually needs to be tested across breeds, and then specifically within breeds. And I think, or maybe within, breed groups, and the differences between big and small dogs. So I think that is really important, and it's relevant in horses as well. I mean, if I think about the amount of flexibility that an Arab has in its legs, it is just mind-blowing when you compare that to older kid, it's very
Yep.
different. And they're both normal. They're just not.
Exactly.
So,
Exactly.
I think that's one of the big challenges that we have in our industry, but it's okay. That was a very good research refresh, and thank you so much for sharing a little bit of information with us here on the podcast. So if you guys want to go and watch it, it's in your canine. It's in your canine members portal. So yeah, let us know what you think. Share your thoughts in the comments about what you think about objective outcome measures, what you're using, and if you're going to go and give the Finnish Canine Stifle Index a try in your practice. Thanks.
Perfect. Thank you for having me today.
Bye, everyone.
Vet rehabbers, for more information on how to take your career to the next level, go to www.onlinepethealth.com. Please don't forget to subscribe to my podcast so you'll get notified. I'm here every single week talking to vet rehabbers from all over the world, learning, and I would love you to join me. Hope you have an awesome day further. Cheers for now.